Welcome. Welcome to this weekly series to address the mental health crisis we are experiencing today as a result of mental pathology in politics. I am Dr. Bandy Lee, forensic and social psychiatrist, president of the World Mental Health Coalition, and convener of the 2017 Yale conference that led to the New York Times bestseller, The Dangerous Case of Donald Trump. 27 psychiatrists and mental health experts assess a president. My colleagues and I came forward in unprecedented ways because of the unprecedented dangers that we saw and the critical need for our expertise. But we were also silenced in unprecedented ways because, like in all authoritarian times, truth, which empowers the public, had become a threat. Amid this silencing, the dangers could only spread, as illustrated in my latest book, The Psychology of Trump Contagion, An Existential Danger to American Democracy and All Humankind. Now, we are trying to rectify this vacuum of the most relevant expertise through a new book and a major all-day conference at the National Press Club, the description of which you can read at the bottom of this video as well as in my newsletters. And indeed, it needs your help in order to make it a major influential event that can make a difference for this election and beyond. Now, today I would like to speak about how mental health issues are difficult to face. Not only are they, do they carry more stigma than physical illnesses, but the very ability to see that something is wrong and to seek help for it is the part that is compromised, unlike physical illnesses, even though in medicine, mental health problems are indistinguishable from physical problems in terms of objectiveness, their basis on data and research, as well as how we conceptualize them through the medical paradigm. But in the public's perception, it carries different impressions because of this affecting the part of the person who is able to seek care and to even distinguish what is mental impairment versus health. So the institutional betrayal that happened with the American Psychiatric Association was particularly devastating. Indeed, in the very beginning of my speaking in public, I was quite impressed at the public's ability to understand mental health expertise as being important for a mental health problem. The news organizations had no difficulty inviting me on. In fact, I felt that it was particularly rational and refreshing that I thought that the decades of mental health awareness campaigns were finally paying off. Well, that was eliminated almost instantly with the American Psychiatric Association coming forward and in effect, spreading disinformation, in my view, because what they were advancing about their own Goldwater Rule, in fact, advancing it as if it were some universal law, when in fact it was only a guild rule that applied to 6% of mental health professionals, given that it only applied to its own members and was not accepted by any other mental health association, as well as unable to be adopted by licensing boards, given its conflict with the First Amendment. But that was the reason it gave to stop our ability to educate the public on what we considered an urgent matter that was a public health emergency, in fact, that was entirely predictable and preventable, applying the principles of mental health. But because it was able to advance the Goldwater Rule as a universal ethical guideline, when in fact we have far more superseding guidelines, such as the core tenets of medical ethics that place our responsibility to society as well as to patients above any etiquette owed a public figure, as well as the universal Geneva Declaration that obligates all health professionals not to cooperate or even to remain silent in the face of a destructive regime, that this would be incompatible with the humanitarian goals of medicine. That was a conclusion of the Geneva Declaration after the Nuremberg trials. And that's a universal pledge taken by all health professionals because it takes the place of the Hippocratic Oath. But in the Trump era, the Goldwater Rule was modified. In fact, 2 months into Donald Trump's presidency, the APA changed the Goldwater Rule to cover all comment on a public figure, regardless of whether it had to do with a diagnosis. Before, it was more about diagnosis, but since the Donald Trump's presidency, it prohibited any comment of any kind relating to a public figure without examination and without consent, which are unnecessary in certain situations that would be of interest to the public, such as fitness or dangerousness. These evaluations are more for the public than for the evaluee, and therefore are not diagnostic exams. They are meant to benefit the public and don't require consent or a personal interview in most cases. And so that was what the public was told, that mental health professionals, even if they were commenting on functional aspects of an impaired public figure, that it would, even in the case of danger to the public's well-being and health, as well as survival, that it would still be unethical. Well, that contradicts all science. It even contradicts all the core tenets of medical ethics, and yet Goldwater Rule was advanced in a way that superseded all other medical principles. Now, I had warned at the time that if a mental health issue, which was the defining feature of the Trump presidency, could not be dealt with in mental health terms, then all other interventions would fail because of the prominence of the mental health issues in this situation. Well, it possibly, and in a very similar way, probably influenced the first impeachment when the Office of Legal Counsel memo was advanced as a reason for not prosecuting a president. In other words, just as the Goldwater Rule prohibited any commentary by mental health professionals on Donald Trump, the OLC memo prohibited any legal counsel, including the special counsel Robert Mueller, who was assigned to investigate his case, from prosecuting a president, a sitting president. Now, that is much like the Goldwater Rule, coming from a federally funded association that was federally rewarded for advancing this viewpoint of its own. The OLC memo was also coming out of the president's own Office of Legal Counsel. It contradicted legal canon, just as the Goldwater Rules contradicted medical canon, and it blocked the ability for a president to be held accountable. The Goldwater Rule for him to be held accountable for unfitness, and the OLC memo kept him from being held accountable for his criminal acts. And therefore, Donald Trump was not able to be removed either by the 25th Amendment or by impeachment. Impeachment we have tried to help with by even writing a letter to the speaker at the time with 900 mental health professionals signing on, emphasizing that impeachment would fail without mental health consultation. And even if impeachment were not possible legally, we had ways of it not being subverted to undermine, or rather to elevate Donald Trump while undermining efforts to impeach him. But as a result, ensued the violent insurrection, which in our view did not occur spontaneously, but had been under intense planning since the presidential debate, when Donald Trump told the white supremacist group Proud Boys to stand back and stand by, which electrified the militia. And they had tripled their membership, readying themselves to act on Trump's cue. Then on in December of 2020, Trump sent out the tweet, there will be a big protest in DC on December 6th. Be there, will be wild. The insurrectionists well understood these instructions, since by now they had a common code language. It's a code language that often develops among tight-knit followers of gang leaders or cult leaders in order to keep the leader from being criminally implicated, even if they were to be caught. But also important is the fact that there was an unspoken understanding through years of emotional communication and contagion. Henry II of England did not have to give explicit orders to rid himself of Thomas Becket, the Archbishop of Canterbury at the time in 1170. All he needed to say was, "Will no one rid me of this turbulent priest?" And 4 knights traveled from Normandy to Canterbury to murder the Archbishop in his own cathedral. So on the afternoon of January 6, 2021, after the violent insurrection that flooded the Capitol with thousands of protesters that resulted in numerous injuries and several deaths, I was flooded with messages. They included text messages from Congress members stating, "You have been vindicated." This was indeed the immediate outbreak of violence I had been warning against in my book that was written several months earlier, Profile of a Nation, Trump's Mind, America's Soul, which was indeed trying to warn against a violent outbreak upon Donald Trump's loss of an election, or even if he were to be elected, that there would be violence afterward because of the Trump contagion he had already induced at that time. The World Mental Health Coalition collected signatures well in advance, and 100 senior psychiatrists and mental health professionals went on video record, endorsing an emergency statement that called for the immediate removal of Donald Trump from office in case he would incite such violence. We warned of the extremely dangerous case of Donald Trump, whose severe mental disturbances are largely responsible for the tragic way that government has terribly mishandled the COVID-19 pandemic. And this was largely based on the mental fitness tests that we had done, based on the data that became available through Robert Mueller's special report. We also stated Donald Trump should never have been allowed to so endanger the country, resulting in enormous costs of life, vast suffering, and escalating social unrest. Now, throughout this period, many had felt the rapid normalization of the abnormal, but could not put it into words. They struggled to explain it through the exposure of hidden corruption or dormant bigotry, or the revelation of the real personalities among his followers. While all this exists and is true, what is often not taken into account is the much more powerful Trump contagion, or the pernicious effects on the culture of having a severely mentally impaired person in high office, having constant exposure to the nation. A British reporter laid it bare when he asked me what we saw at the Capitol was not an insurrection, not a revolution, was it? It was a mass psychiatric condition with delusions and all, wasn't it? I had to answer yes. It was pointless to pretend that a psychiatric issue was a political one. Indeed, that's the mistake that most pundits and news organizations have made, therefore allowing Trump contagion to spread unmitigated and people to be unaware of it, while the media themselves have helped its spread. So this vast exposure has affected the nation's health overall, as well as its collective mental health, in a way that a previously healthy nation was now succumbing to sickness and is caught in what I have come to call a death spiral, or at least until the latest glimmer of hope with Harris-Walz's candidacy. But whether or not it will be able to fully neutralize Trump contagion is still to be seen. So throughout this period, as a physician, I could not help but think in terms of healing and see the countless opportunities we had at every moment to improve our collective condition. Medicine is an art, and because it requires the application of years of clinical experience and decades of scientific knowledge to specific situations, it could not be replaced or could not be compensated for through other specialties as important as they are in the political sphere. The most relevant and the most critical expertise was mental health because of the severity of the mental health aspects. And whether or not we could do very much or assess very much from afar, well, I will say that my internist grandfather, who worked 20 hours a day after Korea's devastating civil war, was with years of practice able to understand, diagnose, and prognosticate patients the moment they stepped into his office. The diagnostic tests that he would later do would only confirm what he recognized immediately upon the instant of seeing them. All the more so, it is true with psychiatry. I'm not saying that I'm the most experienced in my field, but I did have 20 years of experience specifically of Donald Trump's psychological structure, having specialized in working with violent offenders in prison settings, which I found to be the most relevant, where there's the greatest concentration of those with his personality impairments. And also, again, we were not talking about diagnosis. We do not need a diagnosis when speaking of functional assessments such as unfitness or dangerousness. And indeed, we were able to do a full fitness evaluation on him when the appropriate information became available, and we were able to form a panel of some of the top experts in the country. So it's not diagnosis I'm speaking of, and it's certainly not something that cannot be assessed from afar. In fact, there's no greater assessment than observing someone over time in the actual office of which we're assessing the fitness. And the cross-cultural experience that I've had as a medical anthropologist has made me a social psychiatrist, as well as someone who has participated in intervening with the public health. with a public health perspective in violence prevention with the World Health Organization. I had been consulting with them for 25 years, and that human psychology is universal across environments is something that has been impressive to me as I did ethnographic work, and something that we can recognize and intervene with at a cultural level is also something that I have great experience with. So it is indeed unethical to speak of things on which we do not have sufficient information, but I also believe it is unethical to withhold warnings when the information is overwhelmingly abundant, clear-cut, unequivocal, and critical. Actually, mental health experts have a legally obligated responsibility to speak out when there is danger to a person against the self or against others or to the public for mental health reasons. And this is precisely such a situation for which the public has been for too long deprived, to the point where a malignant normality has set in. As my colleague, long-term colleague, Dr. Robert J. Lifton has warned, that without witnessing professionals and without public education, that a malignant normality would set in, which is the mental pathology in politics that I've warned against, and the Trump contagion that has spread. So this coming September, a little more than a month before the election, we feel we have another opportune moment to bring our voices back into the public sphere, thanks to the energized presidential campaign, lifting us out of hopelessness and opening a window for rationality and expertise, as well as the ability to face what is difficult to face, and to overcome the stigma that I believe the American Psychiatric Association has placed on the entire field by singling us out as the only experts who are not allowed to speak in the area of our expertise, which does not exist in any other field. And often I make an analogy to the legal field, having taught at Yale Law School for 17 years. How would the public fare if the public were deprived of legal expertise at a time of Donald Trump's legal cases and criminal indictments? Imagine the public having to decipher everything on their own. Of course, the legal experts who are speaking up are not speaking about a client. They are sharing general knowledge, general legal knowledge of relevant expertise for the public to be able to come to their own conclusions based on what they hear about these publicly very prominent cases that would be relevant to their safety and well-being. So imagine the absence of legal expertise and bring it back to the current absence of mental health expertise, when mental health expertise may have been even more important to propagate among the public, again, because mental health remains the one area where those who are afflicted and in greatest need of intervention would be the least capable of recognizing it. I believe it was the duty of the American Psychiatric Association as a mental health organization to educate the public on this. We were actually hoping that they would take the medical consensus that we had of the dangerousness of the president at the time and to issue its own statement. But instead, it acted to block any public forum. And therefore, That is why we are hoping that this September we'll be able to hold at an even more critical time the National Press Club Conference, a major all-day conference that will echo what we did the year before the 2020 conference, when we brought together 13 top experts of the nation in all different fields, not just psychiatry and social psychology, but the law, history, political science, economics, journalism, nuclear science, and climate science. And our conference was considered important enough that C-SPAN covered all 3 hours of it. And so we hope to do something similar again at a time when we have the potential to have even greater impact in highlighting the importance of fit leadership. We hope to have a similar panel that many have said had been unprecedented and has never happened since, of having 13 experts, top in their field, all together discussing the important issue of fitness and leadership. So we hope to have that again, as well as a full panel of mental health experts who would be available to answer questions from the public, and to have many people attend, including Congress members and the major media, so that they would be able to cover it. And the single theme of the conference will be that Donald Trump absolutely must be kept from entering the Oval Office again, as well as the 3 criminal trials that must all proceed to their conclusion. This conference will only be worth doing and have the kind of influence we need if it can be done in a major way and be made widely known. An individual donor has been extremely generous in making this possible in the first place, and a gracious volunteer created a GoFundMe campaign so as to enable us to raise the funds. So we're happy to announce that we have exceeded half our fundraising goal. We hope that you will help us to indeed reach our goal, to be able to have the kind of influence that we hope to have. You can find the description of our event at the bottom of this video, as well as in my newsletters. So thank you in advance for your generosity.